I noticed, and I don't know if I'm reading into this something that isn't really there or if I'm onto something, but in my read of the chemistry of joy, I detect a stronger belief and enthusiasm about the utility and merits of drug treatment than I do detect in the chemistry of calm, written 4 years later. Also in the chemistry of calm, it's the subtitle that, the chemistry of calm, I guess it's part of the subtitle, but a powerful drug-free plan to quiet your fears and overcome your anxiety. And then in the back of the book, you say, can you really treat anxiety without prescription drugs and antidepressants? The answer is yes. And I'm aware that even in the chemistry of calm, you say that you still recognize that in some cases there's a need for drug treatment, but you warn against the adverse effects, which can be very serious and often, ironically, exacerbating exactly what the person is attempting to relieve. So I would just love to understand like how your thinking has evolved, and especially now today, on the merits and the utility of psychiatric drug treatment.
That's a great question. It's a good observation because you're right. My thinking has shifted over the years. I was never in love with prescribing or with turning first to to medications, and I felt it early in my practice, even when I was in my first job. Excuse me. I felt early on in my practice, even in my first job with the HMO, that we were becoming too quick to prescribe medication. And yet I could see the merit in medication treatment. I think particularly for people who had what I think of as clinical depression, major depression, if you will. I think there's a role for really good medication treatment. My concerns, which became bigger over the years, my concerns are, one, that we're not using medications very judiciously. We're using, high doses, big combinations, multi prescriptions, and it becomes so quickly complex and I think very difficult to really have a good handle on. I don't think there's very many people who do it really well. So one concern is just that I don't think we're cautious enough about how we use medications. But another concern, and this is probably my biggest one, is that I think that something shifted with these new medications that we felt were so safe, so well tolerated, so kind of uniformly effective, that they started to be used for all kinds of other problems that would not have been considered serious enough to warrant medications just a few years before that. So, we diagnose people with depression, for example. We're not very careful, in my view, with how we use the terminology. We diagnose people with depression who do appear or feel depressed, but their symptoms are so clearly caused by situational stresses that, if you really know the appropriate way to use the diagnostic terms, it should be called an adjustment disorder or adjustment reaction. It's a stress-related problem. It's a temporary problem. And what's happened, I think, is that we started using these medications to give people relief from those. I don't have a problem with that. But we weren't also giving them tools to be able to deal with the stresses better. We weren't helping them resolve whatever underlying concerns there were. I even felt there was a time where my psychological colleagues were referring patients to me for medication prescribing long before they should have, that there should have been more time given for, a chance for people to recover or improve with therapy. So there was this big pendulum shift, and I think I was responding to that, or maybe reacting against that.
Mm.
But also, I do think there's a difference between anxiety disorders and depression. If depression is defined a little more tightly, that I think there's so many other ways to approach anxiety, and so many things people can do to develop more skills and use some other strategies and techniques, and natural therapies, I think, can be quite effective with that population. So I think, medications are just overprescribed. They're used too quickly for things they shouldn't be used for. And even to this day, we fail to recognize that being on these medications for long periods of time, people can have a hard time getting off of them.
Right.
And then you can create a whole new set of problems that really weren't necessary.
Mm. Well, thank you for explaining that. And I commend you for kind of being a critic on the inside. I think that the critics within the field of psychiatry are ultimately going to have the greatest influence on the prescribing practices of fellow psychiatrists. And I know that it's difficult to be a critic on the inside, in a sense, to be in that field, to have undergone that education process, to be perhaps surrounded by other colleagues, and to criticize the practice